Okay, so you can all see my presentation here?
Yes, we can. Thank you.
Great, sure. As I'm giving this workshop and wasn't privy to the talks that were given a month ago, some of this may be a little redundant, but what I'd like to tell you about is what the challenges are for adequate transition and how we may conquer those challenges using an electronic platform. So we recognize that adult providers are unsatisfied with the patients that they are receiving on the transition end in terms of adolescence into their young adult practice. In terms of inflammatory bowel disease, 25% of the patients who have inflammatory bowel disease are diagnosed during childhood. And so it's a relatively large population. If you consider that nearly 1.5 people in the US have inflammatory bowel disease, and 25% are diagnosed during childhood, that's a significant proportion of patients who need to make a proper transition. And so this is one study that was done by Michael Haight, which identified issues that adult gastroenterologists accepting these patients had with their transitioning patients. So 55% of these adult GIs felt like their adolescents who were transitioning to adulthood lacked knowledge of medical history, of their own medical history, that nearly 70% had deficits in knowing what medications they had taken or what medications they were on. And of these adult GIs, 15% felt like there was inadequate documentation of the medical history that they received from the pediatric providers that were transitioning the patients. There was an Australian study that showed similar results, that nearly a quarter of physicians believed that their patients were prepared for a transition, which means that the majority believed that their patients were ill-prepared. And so what was felt was that the patient's own lack of the responsibility for their care was their biggest obstacle in transition. And we'll talk a little bit about what the inherent qualities are that are required to make a proper transition for adolescents to adult healthcare. And significantly more adult GIs recognize that this was a problem versus their pediatric counterparts. So it's important that we all work together to advance these goals of proper transition. So again, patients often lack knowledge about their condition and treatment. They are not very good at self-advocacy because oftentimes their parents have been speaking for them or advocating for them, and they lack the inherent qualities that would prepare them for these self-advocacy skills. There's been a poor coordination of care. And in addition, some of the challenges behind proper transition include a lack of resources. So a lack of nursing or nurse practitioners or other allied health professionals who can help us make this transition, little clinical time to spend on educating patients about making a proper transition, and a very large critical mass of patients. We have about 650, 700 patients with inflammatory bowel disease at our center. So having that many patients can often make it challenging to prepare them each individually for a proper transition. The other part of transition is medication adherence, and it's not, specifically a pediatric problem, but as 25% of these patients are diagnosed during their childhood years, this is a primary concern. So we recognize that non-adherence is associated with requiring an escalation in therapy, so beyond oral medications to include biologics and small molecule therapy. It results in hospital admissions and surgeries in inflammatory bowel disease. in this one study that looked at problems of non-adherence. So what we recognize is that overcoming obstacles to proper transition may ultimately improve adherence with their medical appointments and medical regimens and would improve outcomes. There is a scale, a validated scale that transition, interested physicians can use called the Mariski scale. It's an 8-item questionnaire, and it tells you about patients' adherence to their medications. And it takes no more than 2 minutes to complete. In planning out how we're going to best develop an electronic platform for transition, one of the vital components of such an endeavor would include measures of medication adherence using something like the Mariski scale. So what does an electronic platform need to accomplish? Well, I think the first thing is to, by individualizing our approach, identify the challenges for successful transition. And that includes learning more about the particular qualities that each patient has in terms of the personality when it comes down to things like resilience and self-efficacy. Their adherence to medications, or the likelihood that they'll show up for a clinic visit or a procedure. It's important to get more information about these things when setting up such a program. We need to obtain the buy-in from patients, and what I've thought is particularly having focus groups of patients, small groups of patients who can weigh in on the likelihood that what we plan is actually going to bear fruit. Because it doesn't make any sense to develop a patient-oriented electronic platform without the input of the patients themselves. We need, again, to personalize the platform to the individual rather than making it a blanket approach. We need to track their progress and measure deliverables. And then not everything can be done electronically. Some of it requires in-person interventions. And so when is the time to make those interventions? And what red flags would be raised through the transition process that would require this? Remember, the transition process begins in pre-adolescence and is a several-year-long process going through adolescence into young adulthood. It's not one moment in time, as some adult physicians would believe, but it's rather a long process of engendering these self-management skills in patients making the transition. And finally, delivering a summary or a transfer package to the accepting physician, the adult GI, as they recognize that this is a big barrier to proper transition, is obtaining the proper documentation. Wow, this is slow. Okay. In terms of platforms that I'm familiar with, in terms of transitioning patients to adult healthcare in inflammatory bowel disease, our pediatric GI society had a granting process where they awarded a grant to a physician at UCSD to put together a transition app. And what she built was called Doc for Me. It's available on the App Store. And it's billed as a transition app, but really what it does is it allows you to look up the names and contact info of adult IBD providers, and it gives you a list of things that you need to bring to your visit. So to me, this is more of a glorified Yellow Pages and not a proper transition app. I think that this leaves a lot of room for improvement, and if this is the idea of a transition app, it's not really going to accomplish the goals it sets out to do. Okay. So in terms of patient-reported outcomes, what are the underlying qualities that factor into having good skills at transition? So they include these three skills, those of self-advocacy, and there's actually a validated scoring measure for inflammatory bowel disease in adolescents called the IBD self-efficacy scale. And really what that entails is it measures confidence in patients' ability to manage tasks related to the care of their disease. Resilience, and again, there's a validated scoring system to measure resilience called the Connor-Davidson Resiliency Scale. This is a 10-item scale which measures patients' ability to adapt and handle challenges and achieve goals despite obstacles. And lastly, how do patients respond to stress? So again, there's an IBD questionnaire that can measure patients' ability to respond to stress in terms of problem solving, avoidance, physiologic arousal, and emotional numbing. All of these things are critical to measure in terms of at baseline where patients stand in terms of having the skills needed to make a proper transition. And finally, in terms of measuring transition readiness, there is a physician at UNC who's developed a transition readiness score called the transition scale. This is a validated scoring system, again, that measures transition readiness. And so it's important to collect this information, not just at the end of the process, but at several points along the way to make sure that patients are making progress on the road to a proper transition. And so, here is a list of ways to improve transition skills in terms of IBD knowledge, learning basic skills like how to contact physicians and allied health professionals in the clinic, learning more about their medications and adhering to their medications, delving a little bit into their worries about what the future holds for them, making sure that they have a supportive network of family and friends, and obtaining information on how they handle stress and pain and fatigue, which are really all part of living with inflammatory bowel disease, which is the chronic illness that I take care of. Okay, so what I have set out to do is to develop a mobile application that's easily accessible to pre-adolescents and adolescents as old as 18 years old, and to collect information about their skills for eventual transition readiness at baseline. And then along the way to assess transition readiness, adherence to medications, and capture and transmit this data anonymously for later analysis. And hopefully to develop some videos or cartoons so that we can provide information to patients that would be helpful in attaining transition readiness. And finally, at the end of the process, collecting metrics on how user-friendly this application is, both on the pediatric side and learning from the adult GIs whether or not this actually aided in transition readiness. So, one of the ideas I put together is obtaining an electronic passport or journal, having the patient collect their own information. And I hope to find out through focus groups whether this would be at all helpful, because one of those key skills is knowledge about their disease. And so again, collecting these patient-reported outcomes in terms of self-efficacy, resilience, and response to stress at baseline, but then having patients kind of color in the location of their Crohn's disease or ulcerative colitis. What part of the intestine does it involve? When were they diagnosed? What procedures that they had and when? information about their immunizations and DEXA scans and status of varicella and tuberculosis, a list of surgeries and their dates and the surgeons who performed them, and then demographics about insurance information and medications tried and their dates and information about which particular pharmacy they use and allergies to medications. So perhaps collecting all of this information about their particular disease would aid in their transition in terms of their knowledge about their disease. And then it would provide a deliverable to the adult GI who is accepting their transition. And so in terms of medication adherence, it's important to educate patients, and perhaps a video or a cartoon again about how their particular medication works and how it prevents their need for taking steroids, and steroids are plagued with all kinds of side effects, including acne, which our adolescents fear probably the most. How it prevents the need for hospitalizations or surgery, or eventually dysplasia or cancer, colon cancer and ulcerative colitis. So it's important to educate them on adherence and then to measure their adherence to medications. It's relatively easy to measure adherence to medications when they're getting infusions in our infusion center. But if they're self-injecting a medication, or if they are taking an oral medication, that could be more challenging to track and follow. This is the slowest platform. No, just help me out. Okay. And so the North American Society for Pediatric GI, in conjunction with the Crohn's and Colitis Foundation, has developed a transition checklist for patients who have inflammatory bowel disease. And some of these principles can be carried over into other chronic illnesses to aid the transition of patients into young adulthood. And it's important that patients are able to accomplish each of these skills as they go through adolescence, because they're age-appropriate, developmentally appropriate skills for them to learn how to do. Things like describing their GI conditions and naming their medications, being able to call their doctor's office, knowing their medical history and understanding the risks of non-adherence, understanding the impacts of drugs and alcohol, and finally, what does it mean to have insurance, and how long will my health insurance plan cover me, and knowing the impact of my disease on school and work. And so perhaps this can be developed into an electronic, folded into the electronic platform, so that patients can check off these skills as they achieve them. And then providing them some education, again, through either short videos or cartoons on becoming independent, or the impact of drugs, alcohol, and non-adherence on disease, or self-management plans specific to each age group. So I mentioned that there's a validated scoring system. There are several. The one that I'm most familiar with and have used in practice is the UNC transition scale. This was developed by a nephrologist at UNC named Marina Faris for her patients with chronic kidney disease who are transitioning to adulthood. And it's, again, a validated scoring system that measures transition readiness along several parameters, including the medications that they take and their adherence, knowledge about nutrition and self-management, reproductive health, insurance information, the presence of ongoing adult support, and knowledge about new healthcare providers. So it encompasses 10 global skills and 32 questions, and is scored based on their level of knowledge. I thought it's important to obtain this information not only at baseline, but as patients go through the transition process, at least at 3 or 4 different time points. Ay, ay, ay. So I've outlined kind of my thoughts about what an app would include. And I don't know necessarily whether this is going to aid in transition or not. I can make several hypotheses, but until we put it into practice, it's difficult to see how viable this approach is going to be. So does collecting and reviewing information on patients' own disease improve transition readiness? Several authors think that it might, but until we put it into practice, we won't actually know how much transition can be done on an electronic platform and how much needs to be done in person with a nurse or a nurse practitioner or physician. App fatigue is a huge problem. You probably have 30 or 40 apps on your phone that you never use. So it's important to measure app engagement and what can be done to reduce app fatigue, gamification, engaging videos and cartoons. Reducing the number of questionnaires, I think, is important because it can become monotonous. And then random and infrequent pinging of transition readiness assessment. So, in terms of using an app like this, there have been, I reviewed a paper last night that from 2019 in which the authors, let me switch over the video, stop sharing. So in which the authors reviewed 1,600 articles on employing apps for transition. And what they found after weeding through 1,600 articles was that there were 6 that legitimately measured transition readiness. And they found that, that the various approaches that they used didn't really make an impact on transition readiness. These were apps for asthma, type 1 diabetes, and epilepsy. And they found that there might have been better blood glucose control in patients who had diabetes. But other than that, in terms of logging blood glucose data or learning more about their disease, there didn't seem to be a significant improvement in transition readiness. And so my hope is that using a more comprehensive approach, measuring the skills required to make a proper transition in terms of self-efficacy and resilience, measuring medication adherence, providing knowledge to the patients, having them log information about their own disease, and then at frequent time points, at least 3 or 4 times during the process, measuring transition readiness and intervening appropriately would really make significant improvements. And then having a deliverable at the end, a printed report that can be handed off to the adult accepting physician would be an important thing. So those are my ideas about developing an electronic platform for transitioning patients. I'd like to hear your ideas and field any questions that you have about how such a thing could be done.
Thank you so much, Dr. Ziring. That was fantastic. There's a lot of information there that I think is extremely helpful for anyone who's trying to innovate in this space. Do any of the attendees have any questions for Dr. Ziring?
Hi, Dr. Ziring. Perhaps I could ask a question with regards to your engineering plan. You mentioned that you're going to be doing Android and iPhone. Do you have a starting point and have perhaps a prototype that you would develop and how you would go about doing that? For example, would you use just a few measures, or are you trying to develop the whole platform and then test it?
Yeah, so my idea is for a comprehensive platform, and one of the first steps is involving patient focus groups in order to make sure that what I plan is a valid approach. But assuming that all works out and that we obtain the buy-in from patients, I have looked at the logistics of setting up such a system and working with our programmers here, using a dedicated space on the server that's HIPAA protected, and collects information anonymously for later analysis, and allows physicians to have insight into what their own patients are doing in terms of transition. All of these things would be encompassed in such a comprehensive plan.
That's great. Maybe just a small piece of advice. You have an amazing campus there and students. It would be probably very cost effective and fast if you developed just a brief, it's almost like storyboarding, one could say. You don't necessarily need to develop the app as it would function, but just from a display perspective, could be extremely useful and certainly add a great deal to your presentation, because you already have everything in place to execute. And then by presenting a bit of a mock-up or a visual would be quite compelling to add to that.
Yeah, I think that's a great idea. Thank you, Warren. I do think that, in terms of how adolescents learn these days, they're big into visual learning. And so developing storyboards of what such an app might look like would be very important. So I appreciate that advice. That's great.
Dr. Ziring, I have a question. When
Yeah.
you're assessing the patient's readiness to transition, do you also assess their ecosystem and their care teams and everything that happens outside of the hospital to make sure that everyone is on the same page?
Yeah, it was a relatively short presentation that I gave, but I tried to include the need for support networks, and assessing patients, and that's why it's important to make this an individualized approach, assessing their particular support networks, whether it's patients or clergy members or friends, parents or friends or clergy members, or extended family, school, counselors, therapists. There's again a huge ecosystem that supports the patient in their transition. So it's very important to collect that information, and to see how you can bolster support for the patients as they go through this transition.
And another question, is there a toolkit for that support team to aid in the transition of the patient from the patient's perspective?
Yeah, that's a good question. I would imagine there should be. I'm just not so familiar with already developed toolkits. I certainly wouldn't want to create one from scratch if it already exists. So I'd have to kind of look into that.
Thank you. And maybe we can have 1 minute left. Rennie, Courtney, Sana, do you have any questions?
Hi, Dr. Ziring. This is Rennie Partine from CHOC. We always go through this debate of, do we have a disease-specific intervention or app, or do we make it generalized, so that our patients who may have multiple diagnoses or see multiple care teams could still use this app? And I would love to have your insight about the importance of having it be disease-specific or disease agnostic.
Yeah, I mean, I would imagine that there are parts of patients' diseases that make those challenges unique, like, and then there are generalizable parts of having a chronic medical condition that could be in a generic kind of app. So, in terms of the generic stuff, it's adherence to medications, or an asthma action plan, for instance, or measuring glucose or giving insulin. A lot of those things can be generalized. Some of those things are more specific, like pain, and how do you cope with pain, whether you've got sickle cell or Crohn's disease. How do you deal with in inflammatory bowel disease, urgency and frequency and a need to explain an embarrassing disease to your peers? And so there are kind of generalizable concerns amongst many chronic illnesses. And then there are disease-specific concerns. And so perhaps you could develop a general platform for transition and then layer on top of it more disease-specific concerns that would aid in that particular, transition of that particular patient going through their disease. And so you could have, the CHOC transition app, and then you can have the IBD version or the asthma version or whatever that you layer on top of it. That might be one idea of setting up both a generic and a disease-specific model, because there are concerns that are particular to each disease that may not be generalizable amongst many.
That's a great recommendation. Thank you.
Well, thank you so much, Dr. Ziring. We only booked you for 30 minutes, but I did pass on your email to Warren Merrifield, and I recorded the session and I will share it with all of you. Thank you so much. This was fantastic.
Thank you guys for joining.
Have a great
Thank
afternoon.
you so much.
All right, bye-bye.
Bye.